What is the difference between a confounder and an effect modifier? An example of a confounder is as follows. Someone might say that people who drink coffee have a higher risk of lung cancer. That's strange. Could there be another factor at play? Are people with a certain habit more likely to drink coffee, or vice versa? When these groups of people with the outcome, lung cancer, were stratified by smoking status and then asked about their past coffee exposure, within each group there was nothing significant or special about their coffee consumption, or lack thereof. So I've created a table here with smokers with lung cancer and non-smokers with lung cancer, stratified into their two groups. And there was no significant difference in how much coffee each group drank. So it was in fact smoking that was the real player. Another important fact to remember at confounding is a confounding variable has to have an effect on the outcome as well as the exposure. People who smoke are more likely to get lung cancer, and people who smoke are also more likely to drink coffee. That means that in the cohort of coffee drinkers, you are more likely to find smokers, and this would make it appear as though those who drink coffee are more likely to get lung cancer. An example of an effect modifier is the effect of smoking on lung cancer risk in patients exposed to asbestos. Here is an example. Study A shows that in patients with occupational exposure to asbestos, those who smoked had a relative risk of developing lung cancer of 1.5, with a p-value of 0.03. This is obviously a significant finding. In non-smokers, however, with similar occupational exposure, the relative risk was only 1.1. This shows us that non-smokers with asbestos exposure had a lower risk of lung cancer compared to smokers with exposure to asbestos. This brings us on to another important point about effect modifiers. Effect modifiers only affect the outcome. They do not have an effect on the exposure. There is no significant link between how much you smoke and how much you are exposed to asbestos. In this presentation, we have seen how smoking can be a confounder in some cases and also an effect modifier, such as in this example. As always, thank you for watching, like and subscribe, and if you have any comments or any questions, leave them down below.